Welcome back to Mapping Healthcare on KDRT 95.7 FM in Davis, California, where a medic with a map explores healthcare around the world, highlights people who improve it, and shares what we can learn from them. This is your host, Dr. Sheikh. Early in the COVID-19 pandemic, remember the pots and pans? The clanging on balconies, the thank you signs in windows. We call them healthcare heroes. But the pots have long since stopped clanging. Today, that gratitude has been replaced by something darker: hostility, escalating workloads, and an alarming silence surrounding the health of the people wearing those scrubs. We like to think of healthcare workers as being immune to injury. After all, they're the ones who heal the sick. In reality, they are incredibly vulnerable because they almost always prioritize your needs above their own safety. Today, we're looking at a few hazards: biological, sharps, ergonomic, violence, and psychological that are pushing our healthcare workers to a breaking point. There was an intensive care nurse who told a story of, quote, heartbreak he could no longer contain. During the first year of the COVID pandemic alone, he had stopped counting after his 135th patient died. 135 faces, 135 families. It's easy to look at that as just part of the job. But as a physician put it, there's only so much we can give. We are people too. This is the human cost of the hazards we're discussing today. When we talk about biological hazards or workplace violence, we're talking about that nurse's emotions as he walks into the 136th room. We're talking about the moral injury of wanting to help, but being physically or mentally prevented from doing so by the very system you work in. If we look back historically, the evolution of healthcare safety is a bit of a roller coaster. For a long time, the focus was on biological risks. So think hand washing, sterile fields in the operating room, and not catching the plague from your patient. We've gotten better at the technical side of that, but crises have a way of revealing the cracks in our armor. In crisis settings, whether it's the 2004 tsunami in the Indian Ocean, Hurricane Katrina in New Orleans, or the COVID-19 pandemic, the infrastructure often fails first. We see local healthcare workers forced to migrate due to poor pay or dangerous conditions, leaving the remaining staff dangerously thin. We move from just worrying about germs to realizing that the environment itself is a hazard. We're seeing more de-skilling, where highly trained clinicians are stuck doing low-skilled work because of staff shortages, which only adds to the stress and the risk of injury. The definition of safety has expanded too. It's no longer just don't get sick. It's don't get hit, don't break your back, and don't lose your mind. Every year, over 2 million occupational exposures to sharp injuries happen globally. It increases the risk of over 20 types of infectious diseases, including hepatitis B, hepatitis C, and HIV. If you're a physician in training, your risk is highest in the first 3 months of the academic year, July to September. This is the learning curve. And who's at the most risk of injuries due to sharps? Dentists have the highest global prevalence of needle stick injuries. Their work involves constant contact with sharp objects in tight and unique spaces. Beyond the needles, there's the air healthcare workers breathe. Biological hazards aren't just about outbreaks like Ebola or SARS. In disaster settings, mold in a flooded hospital can lead to bronchitis and worsening asthma for staff. Today we're joined by Dr. Piyawan Limpanyalert, CEO of the Healthcare Accreditation Institute in Thailand, who tells us about changes to improve the safety of healthcare staff that she and her colleagues are working on. The views expressed on the show are mine and those of my guests. Dr. Piyawan, welcome to Mapping Healthcare. Today we're talking about healthcare worker safety, which is a bigger deal than most people realize. So you're an obstetrics and gynecology physician by background. You worked as a clinician in this area for over 10 years. And now you work in healthcare accreditation, making sure people receive safe and high-quality healthcare. So from your perspective in Thailand, what are the most common threats to healthcare worker safety, regardless of resources or the setting that they work in?
If I speak from Thailand, I would say we don't just rely on perception. We rely on patients, personnel, and people safety policy and real national data in Thailand. Thailand has officially declared personnel safety goals at the national level, and which this defines priorities, lists, and practical actions for hospitals nationwide. And importantly, we have a national reporting and learning system supported at the national level where hospitals report real incidents continuously. For millions of reports over the years, we clearly see three major risks in Thailand. The first of all, workplace violence, especially in emergencies and psychiatric settings, increasing year by year. The second, infection and occupational exposure with high severity and very important when COVID situation. And the third, psychological harm, burnout, moral injury, and second victim phenomenon that happened in Thailand. What is important is not only the risk, but now we respond it. Thailand has moved from identified list to set like a policy for patient, personnel, and people safety in Thailand. So this is not assumption, this is like a evidence-driven system running in Thailand. And I think it aligns very well with the WHO Global Patient Safety Action Plan, which highlights healthcare worker safety as a core priority.
Yeah, and you, Piyawan, touched on so many important issues with respect to workplace injuries. So, as you mentioned, people in healthcare, they face higher rates of workplace injuries than in many other fields. From things like back strain from lifting patients or needle stick injuries, and you spoke about exposure to infectious diseases. So, in your experience, are there groups of healthcare workers by either by their role? I know you touched on emergency medicine for a bit, but maybe you can elaborate on the specific roles that are more risky than others, specific genders or geography. So, what groups of healthcare workers are disproportionately affected by these personnel safety risks in Thailand?
Yes, and I think the pattern is very clear. Nurse and frontline staff carry the highest exposure, but often have the least decision-making power. And women, who form the majorities of the workforce, face additional risks, including verbal and gender-based violence. And in Thailand, rural healthcare workers face compounded risks with workforce shortage, long hours, and limited support. And in Thailand, we have village health volunteers that are unique state of Thailand, often work alone with communities with minimal protection. This is exactly why Thailand chief forms TP safety policy to ensure that system design protects not only patients but also workers and communities.
Yeah, and the 3P action policy you mentioned, people, personnel, and patients, right? Like just making sure everyone's safe. And you also mentioned certain high risk situations, with respect to nurses, women, people in rural areas that are high risk groups essentially of personnel that disproportionately face safety issues in healthcare. And since the COVID-19 pandemic, the risks that have been tied to airborne illnesses and burnout and stress have become even more visible. And this is personal to me as a clinician, since my colleagues and I dealt with these risks ourselves during the pandemic. Can you share a moment or a story from your work that made the risks faced by healthcare workers feel very real or personal to you?
In Thailand, I work in Hospital Accreditation Institute. When have a serious incident happens, especially one that affects public trust, we don't just investigate. We create like a national learning process. I personally led a root cause analysis with example one hospital. A nurse in ICU was physically attacked by a patient's relative. What we found was very important. It was not just about one person to one person. It was about the system. We found a communication gap during the patient and the family and the personnel or healthcare worker. And no doctor, visitor management for visit the patient in ICU. And no early warning system when has some problem that like something wrong. And no clear protection mechanism for staff. And after that, after we set the root cause analysis each other, we invite the hospital that include the team, the lead team and practitioner in the situation. We invite the expert that have the knowledge about the manage in ICU. We invite the council to join and invite the expert from quality to share and learn together. After that, the hospital redesigned the system, clear communication protocols with families, staff training in conflict communication, rapid response mediation teams, environment redesign for safety to staff, and psychological support for staff. This reflects a key principle in quality and safety. We learn from incidents to improve system, not to blame people, which is also aligned with international safety approaches like a just culture and learning systems.
So, what you described, Piyawan, is one incident that occurred of workplace aggression or violence that led to multiple changes, such as training staff and making sure people know how to de escalate conflicts and manage conflicts in the healthcare setting. And really important, not blame setting, not blaming the healthcare worker for what happened to them. And the issues go beyond physical harm. A lot of healthcare workers, they deal with long hours, staffing shortages, high stress, and this can lead to burnout, anxiety, even people leaving healthcare professions altogether. So, in your experience, what role does organizational culture play either in protecting or putting at risk healthcare workers in Thailand?
Culture is probably the most powerful safety system. Let me share a very simple example from my own experience as an obstetric and gynecologist doctor. When I moved to a hospital that is like a infection and prevention control hospital, treating many HIV patients, I noticed something very different. In my previous hospital, nurses would pass sharp instruments directly into my hand. But in this hospital, they never did that. They placed it in a tray. Why? To prevent sharp injury. And everyone follow it. No exception. With me too. The same with hand hygiene, equipment everywhere, everyone doing it. It becomes a culture, not just a rule. This reflects what we know from evidence. Strong culture and safety culture leads to better outcomes for both patients and staff. That is why in Thailand, we promote no blame, no shame culture, reporting culture, running culture. Because I think if everyone concerned like a routine, this is building the system for protect everyone. Building the safety culture in the hospital is very, very important for me and for my idea.
Yeah, and that's a really good example where you contrasted the difference between two hospitals and basically an act that occurs so many times in a healthcare setting, passing a sharp instrument from one healthcare professional to the other. That very step was so drastically different from one hospital to the other. And you're right. I mean, just the cultural difference in how people go about their daily business really plays a role in keeping people safe. And, workplace violence is another serious concern. And we spoke about how nurses and emergency department staff are verbally or physically assaulted more often than the public might expect. So, what are examples of changes that have made a really big difference in healthcare worker safety in Thailand with respect to bringing down workplace violence?
What made the biggest difference in Thailand is not one intervention, I think. It is a system alignment. First, at the policy level, the Minister of Public Health declared that patient, personnel, and people safety policy that I talked that the TP safety policy. The second, we defined for personnel, like develop the personnel safety goals. That is prioritize the important goal for prevent harm to the personnel. For example, for workplace violence, for mental health, for the infected exposure for the personnel. This is prioritize like the goal. And the third, we build the national level for data system for record the continuous learning. And finally, we embedded all of this into the hospital to invite all of them to join the goals and the guideline for practical. And the last one, we integrated in the hospital accreditation standards. So now personnel safety is a part of the workforce system and risk and safety management, which means it is not a project anymore. It is a routine work measured and improved continuously. This is very consistent with global evidence that integration into system and standard is a key for sustainability and for support to the system for support the personnel or healthcare worker work well-being and safety in the hospital that support policy, resource allocation, and standard in the routine work.
You spoke about so many efforts to improve things. There's better protective equipment, safer staffing ratios, support to prevent stress, mental health support. But, progress in this area is really uneven depending on where you work. Some hospitals are safer than others with respect to healthcare worker safety. So, what would be your message to a healthcare hospital leader in Thailand about how they could create an environment where their healthcare workers feel safe?
I think very, very important leadership is the strongest driver. In Thailand, it starts from the national level. The minister declared healthcare worker safety as a priority. But real leadership happens in all hospitals. When leaders ask our staff safe today, with the same urgency as a patient safety, that changes the cultures. Evidence globally shows that leadership commitment is one of the strongest predictors of safety culture. So leaders must make safety visible, act on staff concern, create psychological safety. And in Thailand, we promote to invite the hospital to join like a project, TP safety project in the hospital, and invite all readers in the hospital to join for share and learning each other. When learn each other, they can know the law of leadership and they can work in their hospital. When their hospital that is successful, we set a platform for sharing and learning and recognize all of them. This is very important that have the role model for leader for protect the personnel, protect the patient, and protect the community. Very, very important.
Yeah, so important words indeed to hospital and healthcare leaders about their responsibility in this important area. Keeping healthcare workers safe isn't just about them, it directly affects patient care quality too. So, if a hospital or clinic in Thailand wanted to start improving healthcare worker safety tomorrow, where should they begin?
My answer is very simple. I think start today, not tomorrow. You don't need a perfect system. Just begin with ask your staff what makes you unsafe. Create a simple reporting system and no blame for learn that is what happened in your hospital or your clinic for the system prevention and fix one real problem. This is exactly how Thailand started. We think every hospital can start by themselves, small steps, but use a system thinking. Very, very important. And in the hospital accreditation standard that support all hospital or clinic to learn the purpose of standard, to design something and implement and learning and improving. We can support a platform for telling and learning each other. I think can start by everyone and every hospital by safety concern to personnel or healthcare worker and support all of them by policy, by the reader support.
Thank you for sharing your years of work in Thailand in helping making sure healthcare workers stay safe in the hospital and health systems that you have there. And we close our conversation in Mapping Healthcare by talking a little bit about the place our guest lives or works in. So, we get a context about the surroundings of our guests. So you work with the Healthcare Accreditation Institute that has its office in Nonthaburi, Thailand. It's about 20 minutes from Bangkok. It's actually maybe some people call it Bangkok's quieter neighbor. So tell us about a couple of places or activities or foods someone new to the area should experience.
For someone new to Thailand, I would recommend experiencing both our culture and our compassion. In Bangkok, visit the Grand Palace and temples along the Chao Phraya River. Outside Bangkok, Chiang Mai offers beautiful mountains, local culture, and wellness traditions. For food, try ต้มยำกุ้ง green curry, pad thai, ส้มตำ mango sticky rice, and most importantly, Thai street food. Thai food reflects Thai healthcare in one way. It is about balance, warmth, and care. Welcome everyone to Thailand. I think Thailand is a country of care and Thailand is a country of smile. Warm welcome.
On that beautiful note, Piyawan, I really thank you for your time. You and I have interacted through ISQA, and one thing that, just really strikes me whenever you talk to me is the compassion and the care that comes out in the conversations that we have, which clearly is reflective of the culture that you live in. So I really thank you for your time, Piyawan, and your generosity in sharing your experience with us today. You have a nice day.
Yes, thank you so much. And I have the short message or take-home message. I think healthcare worker safety is not just a workforce issue. It is a patient safety strategy, a quality strategy, and a health system resilience strategy. And this is strong supported. No patient safety without personnel or healthcare workforce safety. When we protect the healthcare workers, we protect the entire health system. Thank you so much for the opportunity for me and my country and my organization to share with all of you. Thank you so much.
Thank you so much, Piyawan. It was just an absolute pleasure talking to you today. I can feel the compassion and the care for the job that you do in your voice, and really appreciate the privilege to share your work with our listeners. So that was Dr. Piyawan Limpanyalert telling us about work that she and her colleagues are doing in Thailand to keep the people who care for us safe. During the SARS outbreak in 2003, nearly half of those infected were healthcare workers. We saw this again with COVID-19. Healthcare workers were at increased risk compared to the general public, often due to insufficient personal protective equipment. Work-related musculoskeletal disorders, especially neck and back injuries, are common too. If you've ever had a sore back from sitting at a desk, imagine lifting a human being. And when we speak about hazards to healthcare workers, there's one that comes as a shock to many people who don't work in healthcare. More than half of healthcare workers reported being the victim of workplace violence in the past year. Verbal abuse is the most common, but physical violence is on the rise. Healthcare workers are at far higher risk of injury from violence in their workplace than people in almost any other field. And yet, we underreport it. 90% of violent incidents are never officially documented because healthcare staff feel it's just part of the job or that management won't do anything anyway. And finally, we have burnout. This isn't about a person not being resilient. It's rooted in how health systems are set up. We can't just tell clinicians to be more resilient. We need to change our culture to allow them to say, "I'm not okay," without the worry of negative consequences. So what can we learn from this? Here are 3 take-home messages. First, systems, not just people. We have to stop trying to fix the individuals and start fixing the environment. Whether it's providing motorized lifts to save backs or streamlining paperwork to save minds. Second, co-design solutions. The best changes come when staff are involved in the design. Participatory ergonomics, where nurses help plan their own workflow, leads to lower injury rates and higher job satisfaction. And finally, safety is a right, not a luxury. Healthcare staff should never have to go without personal protective equipment or work in fear of being hit by a patient. We need stricter workplace policies and actual consequences for violence. The clanging pots of the COVID era are silent now, but the need is louder than ever. Let's make sure that the people who spend their lives caring for us have a system that cares for them. Thanks for listening. This was your host, Dr. Sheikh. Connect with me on Instagram at Mapping Healthcare. If you enjoyed this episode, please leave a review. It helps get the show in front of new people.